This is a 360 view of the room that I will be performing my focused assessment in. Hi, my name is Morgan. I'm going to be your nurse today. Can I take a look at your armband? And can you tell me your full name and date of birth?
Catherine Ashwell, 4/27/2002.
And do you have any allergies?
No.
And what are your preferred pronouns?
She, her.
This is the correct patient, name, date of birth, allergies, and pronouns to be identified with. Today I'm going to be performing a focus assessment on you. It'll last about 5 to 8 minutes, and I will explain everything thoroughly as I go, but if you have any questions or are in any discomfort throughout the way, please let me know and we can stop the exam.
Okay.
The patient understands the purpose of the exam. Here's a gown. Could you please put it on with the ties in the back?
Mm-hmm.
Are you comfortable in this room in regards to the temperature and the privacy?
Yes.
The patient is comfortable and prepared for the exam, and she is comfortable with the surroundings in the room. I'm going to start by just asking you a few questions. Do you have any chronic illnesses such as diabetes, high blood pressure, or kidney failure?
No.
Does anyone in your family have a history of high blood pressure, diabetes, or cardiovascular disease?
No.
Are you experiencing any chest pain, heart palpitations, or shortness of breath?
No.
And have you noticed any pain or swelling or visible changes in your skin, such as redness or warmth or visible veins in your legs?
No, I have not.
If the patient were to have reported any of these symptoms, I would further assess using Old Cart's ice, and I would also assess using techniques for special circumstances. Now I'm going to get started with my exam. The patient her general appearance is relaxed and at ease. Her breathing is unlabored and quiet, and her skin color is pink, which is appropriate for her ethnicity. I'm going to start by feeling some pulses in your head and your neck just to see how well the blood is flowing to these areas. If you have any pain or discomfort, please let me know.
Okay.
The temporal pulses are equal bilaterally and amplitude is 2+. The carotid pulses are equal bilaterally and amplitude is 2+. Now I'm going to be assessing your arms, and then I'm going to lightly pinch your skin. The patient's arms are symmetrical and in proportion to her body, and there is no edema noted. Now I'm going to lightly pinch your forearm. Skin turgor is elastic and no tinting is noted. Now I'm going to lightly feel your arms with the backs of my hands, and then I'm going to assess your nails and your fingers. Skin is warm and pink. Capillary refill is less than 3 seconds, and the nail beds are 160 degrees, and her nails are pink. Now I'm going to assess your legs the exact same way that I just did with your arms. Patient's legs are symmetrical and in proportion to her body, and no edema is noted. Now I'm going to feel them with the back of my hands. Legs are warm and pink. And now I'm going to check your capillary refill. Capillary refill is less than 3 seconds. Now I'm going to go back to your arms and feel some pulses in both your arms and your legs. Your brachial pulses are equal bilaterally and amplitude is 2+. Your radial pulses are equal bilaterally and amplitude is also 2+. Dorsalis pedis pulses are equal bilaterally and amplitude is 2+. And posterior tibial pulses are equal bilaterally and amplitude is 2+. Now I'm going to move up to your chest and focus on your heart. The chest is symmetrical and there are no abnormal pulsations noted. Now I'm going to feel for your apical pulse. The apical pulse is located at the left midclavicular line at the 5th intercostal space. Now I would auscultate the apical pulse for a full minute. The apical pulse is 73 and regular. Now I'm going to listen to your carotid artery in your neck to see if I can hear any bruise. So when I place my stethoscope, if you could please take a deep breath and then hold it. And one more time on the other side. No bruise are heard over the carotid artery. Now I'm going to listen to various places on your chest with both the diaphragm and bell of my stethoscope. And now with the bell. S2 is louder than S1 over the aortic and pulmonic valves. S2 and S1 are equal at Erb's point, and S1 is louder than S2 over the tricuspid and mitral valves, and no murmurs were heard. And that concludes our exam. And this is another 360 view of the room that I just performed my assessment in.